All right. Good morning, viewers, and welcome to the program Health in Africa. Nigeria is our point of call today, and our guest on the program today is a doctor with age experience, not just medical experience, practical experience on the field. I think growing up as children, we met him treating our parents, and we passed through his treatment. I'm talking about the managing director of Peace Hospital, Dr. Joel Ihanacho. Doc, good morning, sir.
Good morning.
How are you doing today? It's been a while.
Very good, very good.
Thank you, sir.
Thank you.
Today, UStvafrica is with you. We will want to discuss one health challenge that is very common in recent time. That is stroke. To a layman, everybody can simply say stroke, but from the medical perspective, explain to us what is stroke.
Yes, simply put, stroke is it's a brain condition whereby there is a cutoff of blood supply to any part of the brain. Even though the manifestation may be witnessed on the limbs, like the hands and the legs, but basically it is a brain condition whereby a part of the brain is not functioning because the blood supply to that part of the brain is cut off. And maybe you will ask, how does it happen? Basically, there are two types of stroke.
Okay.
It may be an occlusion, whereby the blood vessel supplying any part of the brain is blocked, either by a particle, usually we call an embolus, or the vessel itself can even get constricted, meaning that it got shut up by itself because the pressure coming to it is so high, and it had to probably reactionarily avoid being burst. You have the blood vessel getting shut up. So that's number one. The second one is the bleed. Like I said before, when the blood pressure is so high, it can lead to a burst, a tear
In the
in
vessel.
the vein. And when the blood vessel gets torn, the blood supply to the part it is supplying will get shut up. And the function that it takes will also fail to function. So basically,
And the resultant consequence will be
what I consider will be paralysis or weakness of any part of the body. Basically, the hand and the feet. And that's basically what stroke is.
All right, thank you, sir. Every health challenge comes with a risk factor. What are the expected risk factor in anybody that is affected with stroke?
The most important risk factor of stroke is poor health attitude. We live in an environment where people don't go to routine checkup to know what the state of function of their body is. When they don't go, and we also say that high blood pressure is a sickness of signs, not symptoms, which means that your blood pressure can be high and you wouldn't feel anything.
So you can appear healthy.
Sure, you can
but
be
the pressure
healthy,
is high.
you can be walking up and down, your blood pressure is critically high, and it won't show. Yes, we also know that in some people, it can also manifest, high blood pressure can also manifest with headache, weakness, dizziness, or some other kind of experience that is not unusual. that can restrict people and know that they are sick. In that case, people could even go to the hospital and know that their blood pressure is high. But for a lot of people, yeah, blood pressure can be fine.
Roadside
It
medication,
was,
DCM, and the headache
it's not
will
even
go
roadside
down.
medication. I think there's a situation where you don't even know.
No, maybe when the
Your
headache
blood,
come, you may think it's ordinary headache,
okay,
take pain
okay,
relief, and
yes,
begin to go about without really knowing that it is more than the headache.
yes. For those who have the symptom of headache or dizziness or weakness, these are symptoms that are similar to minor illnesses like malaria. They may go about taking roadside medication, thinking that it is malaria, while it is some other thing. So, most important risk factor is poor health attitude. If where the attitude is right, people can go frequently check, particularly if you know there's somebody in your family who has a blood pressure, they can go and know that they have, the risk factor in their family. Because the runs in family sometimes can be, and particularly hereditary, may not be hereditary, but familiar. We don't know how it happens, whether it can be inherited genetically or attitude, or people who live in this family grew up. It may not be necessarily hereditary, but very familiar.
A certain lifestyle pattern.
Sure. And besides, the truth is that even though high blood stroke can occur at any age.
That was the question I was still going to.
Yes, but
because in the time part, it used to be before now. It used to be sickness of the aged people, but even young men now are beginning to have stroke here and there. A lot of record of young men having stroke.
Yes. Let me finish with the issue of middle age.
Okay.
Risk factor.
Okay.
People who are between the ages of 40, 50, 60 should know that as you age, your blood pressure tends to increase. So there's even no need waiting for somebody to tell you, because you see anything before you to go and check. The normal thing should be, if you are in this age bracket, go and check.
Even if you are
your blood pressure gets a little hardened. So normally, physiologically speaking, blood pressure seems to be higher. This is why you see people in that age bracket. The middle age people have more
record of stroke.
Record of high blood pressure and then stroke. But why does it not happen in younger people? The truth is that we live in a generation where a lot of anxiety, tension, and all those things that can, and even a lifestyle, maybe drinking, smoking, drug, and the neglect of a good medical attitude can lead to younger people having a
high blood pressure.
Yeah, particularly when they tend to have kidney issues that may be silent, you have high cholesterol because eat anything. So even younger people who have such attitude, maybe smoking, drinking, eating any kind of food that can increase the blood pressure, and maybe you have a lot of stress, anxiety because of maybe difficulties around it. They can develop high blood pressure and then stroke.
All right, like you did mention in the introductory part of the discussion, what exactly are the major signs that one will begin to look out for to notice that maybe there's likely going to be stroke? What are the early signs of stroke?
Early signs of stroke, number one, is that you may start having pounding heartbeat. Heartbeat. Normally speaking, you shouldn't feel the beating of your heart. But when you see your heart pounding,
and you feel it.
You feel it. You should have something wrong with your blood pressure. Then persistent headache can also be a sign. The weakness of any part of the body, or even tingling of any part of your limb, maybe the hand or the feet, it should tell you that everything is not
It's not
normal.
normal in this case.
You should go and check. But if you miss it at that stage, probably you have what we call TIA, translate ischemic TIA. So whereby you will even be knocked off, and maybe after a little while you get up. It's an important warning.
That one get knocked off.
Yeah,
Unexpected.
transient ischemic attack can make you slump, get unconscious, but irregular in a matter of minutes. It's an important sign. So if you don't take it at that stage to go and check your BP, your cholesterol, the next time you will get struck, you may not easily get up like you did at the first time.
All right, sir. What would be your advice for our viewers at home on the things to do and what not to do when go and seek medical advice? Noticing, what is your advice to viewers as regards stroke generally?
Yes, my number one advice is for our people to acquire the attitude of going for frequent medical checkup, particularly for blood pressure, for sugar, for cholesterol, if you can. It's if you know your status, your blood pressure status, you can do something to avoid it. Fortunately enough, blood pressure has a lot of drugs you can use. There are cheaper ones, there are more costlier ones you can use. So nobody should actually be going to stroke if you know that you have high blood pressure and you are taking care of it. So number one is that we should acquire the attitude of going for frequent medical checkup. If it's in your family, maybe you go once in a month, once in 6 months, if you don't have any family history of it. And if you have checked once and it's getting up, you check more frequently. Well, number two would be attitude of reducing stress. There are many things that make people stress. Yeah, find time to rest and avoid a lot of anxiety and depression, carrying on the burden of what is happening around you, maybe economically. You can afford to relax your mind and trust God that with time, those things will come and go. But if you carry all the stresses because of things are not working fine, the stress will remain and you will not wait to see the end. So please, the reduction of stress, another thing after, yes,
overthinking and everything that will overlay the brain.
Exactly. And number one, like I said, is the attitude of everybody going for frequent.
Not until
you start having anything.
And even if you appear healthy,
it's a silent killer. Quiet, can be quiet. And like we said, some of the symptoms that you may present at first may be one that are not different from the symptoms you have when you have malaria or some other cold. So until you have checked, you cannot say my BP is normal. Some people have not checked their BP in the last 1 year or two. Say that my BP is normal. It doesn't make any sense. So please go and check.
Okay.
Please go and check.
Number one, do regular checking. Number two, relax.
Yes.
Then avoid anxiety and everything.
We can now talk about avoiding alcohol and salt, a lot of salt. Salty food, snacks that can also increase cholesterol, bad fat in your body. These are the risk factors that we can advise. Take a lot of water to rehydrate yourself. When you rehydrate, your body flows well. Sometimes we advise people to take, particularly at that age, between 40, 60, you can take low dose aspirin, which is very, very cheap It can be a routine to take one tablet of loaded aspirin every day to help to make we call it blood thinner. Your blood doesn't get thick, it keeps flowing while you rehydrate. Then eat vegetables, and don't eat, fried and fatty food all the time. Take vegetables, take fruits. Make it a habit to always take fruit, vegetable every day. It helps your general health and the heart function. That will help you to reduce the risk of stroke.
Well, thank you. Before drawing the curtain, I've already rounded up the question, but so I just came up to at what stage can one say that stroke cannot be cured? Does it have medical cure? Can stroke be cured medically?
Yes, to a great extent. If you get stroke treated early, like I said, there are two types. If it's an occlusive type, the earlier you reduce the blood pressure, it can even help the shut up or the clot that is plugged that vessel to resolve. And then with time, even though recovery may be slow, some can even be fast, but you can cure it that way.
Okay.
And like with recovery, if it is a bleed, the recent management is that if somebody in cities where you have the facility, somebody has a sign of stroke, you go to do a CT scan. There are some stroke specialists that can do a surgery, evacuate the clot, and the recovery can be so dramatic. But at our level, the rural level, we basically treat the blood pressure, make sure that cholesterol is not high. As when you keep the blood pressure low, another factor that could include make the blood vessel to open up, so to blood supply. Many of them are resolved. Many they resolve.
All right, thank you very much. You as here will draw the curtain on the program today, and I am sure you will have learned a lot from this. Do not forget that we are at Peace Hospital right in Aniba, and the guest on the program, like I told you, is an experienced doctor that have practiced for many years. Dr. Joel Iheanacho is the guest. Doctor, you're welcome.
It's my pleasure.
We hope to see you again on another edition of this program.
Thank you so much.
Thank you very much.
Thank you for coming.
Thank you.
Wish you safe journey as usual.
At USTV confirmed news, culture and entertainment, the latest information all at USTV. Your number one internet station, USTV. The need of the best, USTV. USTV, Unity Star Television, always ahead.